Hey guys, I want to read an article that came out recently on gabapentin. Many of you are familiar with gabapentin. Some of you, well, a lot of you have reached out and asked me, is this something that could help me come off benzos? I knew someone that said they used it to come off benzos. And I always caution everyone because I've seen some really negative stuff come from it. Now, I have heard some positive stories. To be fair, I have heard people say they use gabapentin and it helped them come off benzos. It's something to consider. I would say that perhaps. But it seems like I'm seeing more negative than positive on this stuff. And if anything, I think probably using it, you would need to do it very delicately, very safely, and under a short period of time. I mean, it would have to be the right circumstances to take gabapentin while coming off benzos. Otherwise, I've seen it just wreck people. I mean, I've had clients that came off benzo and then they were stuck on gabapentin and they suffered like you would not believe trying to come off gabapentin. I mean, the withdrawal from gabapentin at that point seemed to be just as bad, if not worse, than benzo. So here's an article I found recently, July 15th, 2020. It's gabapentinoids involved in a third of overdoses in Scotland. And I'll just read you some of it. A new study in Scotland is shining more light on the risk of overprescribing gabapentin, Neurontin, and pregabalin, Lyrica. The two drugs belong to a class of nerve medication called gabapentinoids, which are increasingly prescribed in Western nations to treat chronic pain. And now for benzo withdrawal. In 2008, there was 1,187 accidental drug-related deaths in Scotland, the highest overdose rate in the European Union, and gabapentinoids were involved in about a third of them. So we got almost 1,200 accidental drug-related deaths, and gabapentin were accounted for a third of them. That's incredible. That's what, 400? 400 deaths to gabapentinoid? I mean, who's hearing about stuff like this? According to research published in the British Journal of Anesthesia, gabapentin was implicated in 15.2% of fatal overdoses in Scotland, while pregabalin was linked to 16.5% of drug deaths. That's up 3% and 1% of fatal overdoses, respectively, in 2012. So this is a trend that's been going on. This is not just something new that's rising. Researchers say deaths involving gabapentinoid are rising because they are frequently co-prescribed with other opioids and other medications that depress the central nervous system and raise the risk of overdose. Drug diversion also plays a role. Gabapentinoid prescribing has increased dramatically since 2006, as have dangerous co-prescribing and death. Older people, women, and those living in deprived areas were particularly likely to receive prescriptions. Their contribution to drug overdose deaths may be more related to illegal use with diversion of prescribed medication, wrote lead author Nicola Torrance, PhD senior research fellow at the School of Nursing and Midwifery. From 2006 and 2016, the number of pregabalin prescriptions in Scotland rose by an astounding 1,600%. So in 10-year period, 1,600% prescription increase, while prescriptions for gabapentinoid quadrupled. About 60% of the time, gabapentin was prescribed with an opioid, benzodiazepines, or both. I'll say that again. About 60% of the time, gabapentin was prescribed with an opioid or benzodiazepine or both. Gabapentinoids are also showing up in Scotland's illicit drug supply. Drug users have found that they can heighten the effect of heroin, marijuana, cocaine, and other substances while taking gabapentin. In the Scottish region of Tayside, gabapentinoids were involved in 39% of drug deaths. About 3 out of 4 of those overdose victims did not have a prescription for the drug. So that's pretty high. 39% drug deaths, 3 out of 4, 75% of people didn't have a prescription. In addition to overdose, gabapentinoids have also been associated with increased risk of suicidal behavior, accidental injuries, traffic accidents, and violent crime. UK health officials were so alarmed by misuse of the drug and the rising numbers of deaths that gabapentin and pregabalin were reclassified as controlled substances in 2019. So there you go. These guys are starting to recognize, oh wait, this drug isn't so safe at all. So there you go. Reclassified as controlled substances in 2019. Article goes on, gabapentin is not currently scheduled as a federally controlled substance in the United States, but pregabalin is classified as a Schedule 5 controlled substance, meaning it has a low potential for addiction and abuse. I don't agree with that. Schedule 5 controlled substance, meaning it has a low potential for addiction and abuse. I mean, look at the findings in Scotland. What the hell are you talking about, right? 2019 clinical review found little evidence that gabapentinoids should be used off-label to treat pain, and that prescribing guidelines often exaggerate their effectiveness. A clinical 2009 review found that little evidence that gabapentinoids should be used off-label to treat pain, and that prescribing guidelines often exaggerate their effectiveness. And yet that's where we see most of the prescription being used here in the States, right? U.S. Food and Drug Administration also recently warned that serious breathing problems can occur in patients who take gabapentin or pregabalin with opioids or other drugs that depress the central nervous system. This is true with benzodiazepines, by the way. So there's an interesting article on gabapentinoids, and curious of what you guys think. What have been your experiences and some of your stories? Please leave a comment, like, subscribe, and let me know what you think.